Dr. Daniel Amen is an award-winning psychiatrist, brain imaging expert, researcher, and best-selling author. He's here today to help you change your brain and change your life.
Thank you. I'm Dr. Daniel Amen. I'm so excited to be with you. Through our brain imaging work at the Amen Clinics, with tens of thousands of patients from 62 countries over the last 2 decades, I've come to see with my own eyes that you can literally change your brain and change your life. This is one of the most exciting breakthroughs in medicine, because with a better brain always comes a better life. If you pay attention to me, if you use the front part of your brain so that you can focus, and if I can touch your emotional brain so you remember what I say, and if your brain is flexible enough to learn new things, then you're in for a treat. When you make your brain better by doing the right things, you improve your life. When you do the wrong things and hurt your brain, you make your life harder. Day in and day out, every day, you're either helping or hurting your brain. Did you know that blueberries are one of the best brain foods on the planet, along with avocados, walnuts, salmon, and green tea? But not getting enough sleep decreases blood flow to your brain and impairs your memory and your ability to concentrate. Did you know that increasing blood flow to your brain is literally the fountain of youth? But doing things that decrease blood flow, like nicotine, too much caffeine, alcohol, inhaling toxic fumes, prematurely ages the brain. This program will be divided into 3 parts. In part 1, I'll give you 7 simple principles to change your brain and change your life. I will also give you 1 question you should ask yourself every day if you really want to be successful in your life. In part 2, I will show you how to be happier, more focused, less anxious, and less depressed by balancing 3 important and very interesting brain systems. I'll also teach you a sneaky brain-based strategy to help you deal with the difficult people in your life. And in part 3, I'm going to show you how to make your brain great. You are not stuck with the brain you have. You can make it better, and I will show you how, including how to prevent Alzheimer's disease. And I'm not kidding. This program will also give you a completely new paradigm about why people struggle, along with new insights into healing the brain. For example, I want to tell you about a couple who failed marital therapy. That's right. Their therapist gave them an F. Now, how do you get an F in marital therapy? Well, after spending 3 years and $25,000, the therapist told them to get divorced. Well, this made the couple very upset because they wanted to be married. On the television, you see 2 brain SPECT scans. These are the scans that we do in our clinics. They're called functional scans because they show how the brain works, how the brain functions. What they measure is blood flow and activity patterns in the brain. Now, the scan on the left is a healthy scan, and what you see is full, even, symmetrical activity. Now, the image on the right is the husband's scan, and that Swiss cheese appearance indicates overall severely low activity in his brain. Now, this is the pattern that we often see with drug and alcohol abusers. But the scan didn't fit his history because he said he never used drugs and he didn't drink. Now, I've been a psychiatrist for a long time, and I know that drug addicts and alcohol, they lie. And they lie a lot. Right? Am I wrong about this? They lie a lot. So, in front of his wife, one of my first questions to him was, "Are you sure you don't drink much and you've never used drugs?" He said, "Dr. Amen, I have many problems, but that's not it." So then I turned to his wife and asked her if that was true, and she said, "Oh yes, Dr. Amen, he doesn't drink, he doesn't use drugs, he's just a jerk." And I chuckled at the comment, but then, in my mind I wondered, then why does his brain look so bad? And so I went through the potential causes in my head. A brain infection. A near drowning can make your brain look like this. Low thyroid, being anemic, being exposed to some sort of environmental toxin. So my next question to him was, where do you work? He said, I work in a furniture factory. I said, what do you do? He said, I finish furniture all day long. He was doing drugs. In fact, he was doing the worst drug for your brain, which is inhaling organic solvents. So my next question to the wife was, so when did he become a jerk? And she said, what do you mean? I said, did you marry him that way? Do you have father issues that you're trying to work out? And she said, no, when we first got married, he was great. It wasn't until about 5 years ago that he started having trouble. And then she put her hand over her mouth and she said, oh my God, that's about the time he started to work in the furniture factory. Do you think his personality change can have something to do with his job? So as you can imagine, the first thing that I should do is get him out of that toxic environment. So I had him transferred in his company. And then I put him on a brain-healthy program. On the right treatment, his behavior got better, as did his marriage. I wonder how many marriages are suffering because one partner has a brain problem that no one is aware of. How do you do marital therapy with this brain? It will never work until you change his brain. Now, looking at the brain has been one of the most exciting adventures of my life. In the past few years, I've come to distill our work into 7 very simple principles. And if you follow me, one, you'll realize how simple these are, but they will change your life as they have changed mine. The first principle is your brain's involved in everything you do. Your brain's involved in how you think, in how you feel, in how you act, and how you get along with other people. After looking at 40,000 scans, I've come to believe that your brain heavily influences the type of person you are. Your brain is the organ of personality, of your character, your intelligence, and your soul. I've actually called the brain the hardware of the soul. Now that leads us into principle number 2, and that is when your brain works right, you work right. And when your brain has trouble, you have trouble in your life. So here are 2 more SPECT scans. The scan on the left is of a healthy person. The scan on the right is a heroin addict's brain. Drugs damage your brain. Do you think the heroin addict has any possibility of living up to his potential? I don't think so. The hardware of his brain is definitely not working right. When your brain is healthy, you tend to be focused, happy, relaxed, loving, effective. When your brain is unhealthy, for whatever reason, you tend to get distracted easily, you're sad, anxious, angry, not as effective. And that brings us to the next principle. It's a fascinating principle. And did you know your brain is the most complicated organ in the universe? There is nothing as complex as the human brain. Nothing. It's estimated that we have 100 billion nerve cells and more connections in our brain than there are stars in the universe. Information in your brain travels at about 268 miles per hour. Unless, of course, you're drunk. And then things really slow down. If you don't take care of your brain, on average, you lose 85,000 brain cells a day. That's about a brain cell a second. That is what causes aging. Now, with appropriate forethought, you can reverse that trend and dramatically slow the aging process. Now, that's a big promise. But if you pay attention to me, we're going to talk exactly how to do that. Now, the next principle number 4, is absolutely critical. But virtually no one knows it. Or at least for sure we don't act in our society as if we know it. And that is, your brain is very soft. And it's housed in a really hard skull. Your brain is the consistency of soft butter, tofu, custard, somewhere between egg whites and Jell-O. And it's housed in a really hard skull that has many sharp, bony ridges. Brain injuries matter. They damage the brain and they can ruin your life. We need to do a much better job at taking care of our brains. The next principle is many things can hurt your brain. And many things can help your brain. So let's talk about that, because you want to know what it is. So what are the things that can hurt your brain? Well, we've already talked about a couple of them. Drugs, very bad for brain function. Toxic fumes, head injuries. Alcohol is not a health food. Now, I know many of you are out there and you're like going, gotta have my glass of red wine a day. Doctor says I have to do it. This is good for me. No. The research really says 1 or 2 glasses a week can be helpful for you, because a little tiny bit of alcohol tends to balance cholesterol levels. People who drink every day have a smaller brain. And I would just suggest to you that when it comes to the brain, size matters. You don't want a smaller brain. And alcohol is directly toxic to brain function. Lack of exercise. If you don't exercise on a regular basis, that's decreasing blood flow. It's very bad. You'll notice we're going to talk a lot about exercise. Not getting good sleep. People who get less than 6 hours of sleep at night have lower overall blood flow to their brain. And with that comes all sorts of problems. Chronic stress. I mean, we're living in this fast-paced society, often under a lot of stress. And if you don't have a stress management technique, this is prematurely aging your brain. Smoking. Smoking is a disaster for brain function. Now, can you tell the skin of a smoker? How? Dry. Wrinkled. Doesn't look healthy. Why? Because smoking constricts blood flow to your skin. It does exactly the same thing to your brain and prematurely ages it. And did you know too much caffeine can do the same things? Now, I already know some of you are going, okay, doc, how much can I have? And I have to tell you, 1 or 2 cups a day, it's not that bad for your brain. More than that, it's a nightmare for brain function because it constricts blood flow. It also dehydrates you. And it fools you into thinking you don't need to sleep. That's why as soon as you wake up, got to have my cup of coffee in the morning, right? It's not good for you. You can do without it. Negative thinking is terrible for brain function. Isn't that interesting? That if you focus on what you hate about in your life, your emotional brain fires up, but your thoughtful brain gets colder. So you become unhappy and you make bad decisions. So how you think moment by moment determines in part how your brain works. Okay, now these are things that hurt your brain. Let's talk about some things that help your brain. New learning, like tonight. Whenever you learn something new, your brain makes a new connection. When you stop learning, your brain actually starts to disconnect itself. You always want to have a new project where you're learning something new. A healthy diet. You are what you eat. We're going to spend a lot of time in the last segment talking about brain-healthy foods. Daily, vitamins and fish oil. We'll talk about that, as we will exercise. Exercise is literally the fountain of youth, and I'll tell you why. Getting great sleep is important. Social connections. Being with other people, especially if they're good for you. But going to church, being part of a family, being part of a hobby club, all of those things are important because when you're with other people, your brain has to work, right? You have to remember their name, and do they have kids, and what does that look mean, and all of that is working your brain. Positive thinking, especially gratitude. When you focus on what you love about your life, your brain works better. The emotional brain sort of settles down, the thoughtful brain goes up. You're actually more coordinated when you focus on what you love about your life. So very simple exercise that you can take home. And they've actually found this to decrease depression in people who have clinical depression is just write out every day, 5 things I'm grateful for today. 5 things I'm grateful for today. It can be your health, your family, your job, whatever it is. It can be your dog, whatever it is. Focus on it, because when you bring your attention to gratitude, you feel so much better. Interestingly, meditation is also amazing for brain function, and meditation fooled us. Those of us that are brain imaging doctors thought what meditation would do would be calm down the brain. It absolutely doesn't do that. What meditation does is it activates the most thoughtful part of your brain, so that you make better decisions, so that you feel happier, so that you're actually more intelligent. And did you know that making love is good for your brain? Regular sexual activity has been shown to be associated with decreased depression, so it helps your mood, it helps your memory, it helps in pain relief, so when she says, "Honey, not tonight, I have a headache," you can say, well, did you know there are 2 studies with migraine headache sufferers that say having an orgasm decreases pain frequency by 50%. I'm just here to help. And there's a study from England that says 3 times a week. 3 times a week is associated with decreased risk of heart attack and stroke by 50%. We have no medicine that can do that. Right? So many things can hurt your brain. Many things can help your brain. This next principle is really important. And that is, one size does not fit everyone. Most psychiatric problems like ADD, anxiety, or depression, they're not single or simple disorders. Giving someone the diagnosis of depression is exactly like giving them the diagnosis of chest pain. Now, why don't doctors give people the diagnosis of chest pain? Because it's a symptom. There are too many causes. The same thing is true for depression. It's a symptom with many different causes. Chronic stress, relationship problems, financial losses, head injuries, drug abuse, low thyroid, chemical imbalances, even grief. Our research at the Amen Clinics has shown that it is at least 7 different things. And giving everyone the same treatment for this symptom invites disaster. In the next segment, I'm going to tell you about a revolutionary brain-based approach that helps us heal problems like depression or ADD. We do it more quickly and often with natural treatments because we understand what part of the brain that we're dealing with. Now, the last principle, the most exciting thing that I'm going to tell you, is that you can change your brain and change your life. Your brain can change. On the television, you see 2 SPECT scans. This is a patient that came to see me because he had temper problems. The image on the left shows low overall activity. The image on the right, just after a couple of months of treatment, looks so much better. And as his brain got better, so did everything in his life. How exciting is that? You literally can make your brain better. You're not stuck with the brain you have, even if it's troubled. Now here's an image of a healthy brain. So this is from our very rare group of healthy people. You know, it took us almost 3,000 people screening to find about 90 healthy brains. So if your brain is struggling, well, welcome to normal. Okay, normal is not healthy. Okay, this is an 82-year-old brain, drop dead gorgeous, and it fit her life. Still very active, in church, with her family, married in a good marriage for 57 years. This is what a healthy brain looks like. Compare it to someone who had a stroke. Strokes are a disaster for brain function. This is why you shouldn't smoke. Did you know that smoking is the #1 cause of strokes? This is what Alzheimer's disease looks like. Alzheimer's disease ravages brain function. Now, our brain scans can tell 5 to 10 years before you have symptoms whether or not you're likely to get it. Whether or not you're likely to get it. But you want to be working early to prevent Alzheimer's disease because it's a nightmare for brain function. The real reason not to use drugs? They damage your brain. And if they damage your brain, they damage your life. So here's, for my own patients, this is a cocaine brain, a methamphetamine brain, an alcoholic brain, and a heroin brain. The one question you always want to ask yourself if you want to be successful is, which brain do you want? Is your behavior day in and day out every day helping or hurting your brain? You want to ask yourself that question every day. Now, when we come back, I'm going to show you how to be happier, more focused, less anxious, and less depressed by balancing these very interesting 3 systems in your brain. I'm also going to show you this very sneaky way to deal with difficult people in your life. Stay tuned. Thank you. Welcome back. I love this segment because I'm going to teach you what I call practical brain science to make your life better. As you will see, brain science is eminently practical because your brain's involved in everything you do. In the next few minutes, I'm going to introduce you to 3 parts of your brain that drive a great deal of your behavior. We're going to talk about an area of your brain called the prefrontal cortex. It works as like the boss in your head. And we're going to talk about your cingulate. That's the brain's gear shifter. And then we're going to talk about your limbic, or your emotional brain. As you will see, knowing how to optimize these systems will improve everything in your life, even the other people. Whenever we discuss humans, the first area of the brain that we have to talk about is the prefrontal cortex. It's largest in human beings than in any other animal by far. This is the part of your brain that actually makes you human. It's 30% of the human brain, 11% of the chimpanzee brain, 7% of your dog's brain. This is my dog, Fraser. Isn't he cute? I love Fraser. And how many of you have cats? Love your cat. Well, this is my cat, Annabelle. And cats have virtually no prefrontal cortex. Cats have no forethought, very little impulse control. Annabelle lives totally in the moment. She doesn't think about the past. She doesn't worry about the future. It's just now. Now is all that matters. So the prefrontal cortex is the executive part of the brain. It works in your head like the boss at work. Things like focus and forethought, judgment, impulse control, empathy, learning from the mistakes that you make. This is the part of your brain that's involved in maturity. When there are problems in this part of the brain, you act like a cat. I mean, how many times have I told her, don't do this? Doesn't matter. Okay, when there are problems in this part of the brain, what we see is short attention span, impulse control problems. They procrastinate, they put things off, they have bad judgment, they don't have much empathy, and they don't learn from the mistakes that they make. Haven't you ever wondered about yourself or someone else? It's like, why aren't they learning? Why aren't they getting it? And it's because this part of the brain may not be getting good function. So when we see low activity in this part of the brain, it's associated with people who have bad habits. You know that person who always shows up to work 10 minutes late with a big cup of coffee? Odds are low activity in this part of the brain. Or people who smoke, or internet gambling. Low activity. They're looking to stimulate it. People have attention deficit disorder. You've heard about ADD, very commonly diagnosed in children, but did you know it's also very common in adults? Most of the kids who have it grow up and have it as well. And our research studies and other people's research as well has shown low activity in this part of the brain. People who have a weak conscience, who make decisions and you're just like, why did you do that? Low persistence. They can't stick with things. some forms of depression, especially low energy forms of depression, and people who are excitement or conflict seeking. Do you know anybody like this? These are people who play this game I call let's have a problem. It's like they need to be upset in order to concentrate. It's like being upset actually stimulates their brain and helps them feel more normal. So as kids, they pick on their brothers. As spouses, they may pick on their spouse, right? Or they may be stirring it up at work. So what do you do? How do you treat this if you have problems in this part of the brain, which are very common? Well, one of the things that we found to be so helpful is getting them to write out their goals. It's an exercise we call the one-page miracle. On one piece of paper, write out what you want in your relationships. What do you want at work? What's your goal? What do you want for your money? And what do you want for your physical and emotional and spiritual health? What do you want? Write it out. And then you look at it every day and you go, is my behavior getting me what I want? The second thing is exercise. Exercise actually boosts blood flow to this part of the brain. Now, I have a specialty in people that have attention deficit disorder. And many people ask me, okay, I don't really want to take medicine. What is the best natural treatment for ADD? And what it is, it's intense aerobic exercise, along with a high-protein, low-carbohydrate diet. Now, this diet is not good for everybody. But for people who have ADD, or people who have low activity in the front part of their brain, and they have trouble with concentration, and they're disorganized, and they procrastinate, this is a great diet for them because it helps their energy and it helps them concentrate. Fish oil. Fish oil is so helpful. Now, we'll talk about it later, but for now, just know it helps increase your energy and your concentration. And if needed, there are certain natural supplements and certain medications that can be so helpful. And in my book, Change Your Brain, Change Your Life, I talk about what those are. The next part of the brain that I want to teach you about, or talk to you about, is called the cingulate gyrus. So here we're looking at the brain from the left side. So this is the back to the right. Here's the front. And this area right here in the front is called the cingulate gyrus. And it's so interesting. Now, the cingulate, that's like a big word. But what it basically means is this is the brain's gear shifter. It allows you to shift your attention, right? To go from idea to idea, or go from task to task. It also helps you be flexible, to go with the flow, so you don't have to have things your way. It's heavily involved in seeing options. You know, people that are rigid, it has to be their way. There's no option. When it works right, you can see many different options, which means it helps you cooperate. It helps you get outside of your head and into the head of other people. It's hugely also involved in error detection. So if you walk into a room and you see something that's out of place, it's the cingulate gyrus that's telling you this is out of place. And when it works too hard, if you want to make those people crazy, just like move something. You know, like turn the picture a little bit or mess with something, and they just, I know it's wrong. Something's wrong. Something's wrong. Now, when there are problems in this part of the brain, when it works too hard, which is usually due to a deficit in the neurotransmitter serotonin. When it works too hard, which is usually due to a deficit in the neurotransmitter serotonin. And when serotonin levels are low, the cingulate gets hot and people get stuck. They might get stuck on a worry. What's a worry? It's an anxious thought that they can't let go of, right? Or they might have an obsession. You know, they're driven to do this thing that they can't let go of. They get stuck on hurts and hold grudges. They get stuck on certain behaviors and may have compulsions or addictions. They get stuck in their own position. It's so irritating because they end up to be oppositional and argumentative. People who have this problem, it's like no matter what it is you say to them, they argue with you. Have you ever been around people like this? Am I the only person? I mean, if you say it's a nice day today, I mean, something is innocuous, it's a nice, they'll immediately go, oh, it's not that nice. It was nicer yesterday. They see too many errors. So they're always fault-finding. They're always noticing what's not right. They tend to be micromanagers at home and at work. And they tend to be rigid and inflexible. And if things don't go their way, they get upset. And on the surface, they appear selfish because it has to be their way. But when you understand it from a neuroscience standpoint, they're really not selfish. What they are is inflexible. There are many ways to help this system. And this is such an interesting system. So the first thing, if you have this problem, and you notice you get a thought in your head more than 3 times, I want you to physically get up and go do something else. The act of distracting yourself helps to get these thoughts out of your head. People who have a high cingulate do better with options. So if you're married to a person like this, never go, okay, we're going to dinner here. Even if here is their very favorite restaurant. Don't do that. It's always better to go, you know, we could go here, or we could go here. What would you like? And if you give them options, they do so much better. Reverse psychology. Now, reverse psychology does not work for everybody, but it really works with these people. So if you're living with a difficult cingulate person, a sneaky strategy that works is to ask them to do the opposite of what you want them to do. It's sort of like living with a 2-year-old. And if you wanted a kiss from a 2-year-old, you would never say, give me a kiss. Because as soon as you said, give me a kiss, I don't want to. If you really want a kiss, what you say is, I don't want a kiss. Today, we're not kissing. No way, we're not kissing. And within 30 seconds, they have to give you a kiss or they're going to die. Living with a singular person is sort of the same thing. And exercise. Exercise is amazing for this part of the brain because what exercise does is it boosts serotonin levels to the brain and it makes people more flexible. So if you're in a fight with a cingulate person, the best thing you can do is take them for a long walk. Now, for the first 15 minutes, don't talk about anything that's sensitive. After about 15 minutes, what you'll notice is they're just so much easier to get along with and they're more likely to see your point. Now, if you give these people a high-protein, low-carbohydrate diet, they will concentrate better on the things that bother them. But they get more irritable. The best diet for cingulate people is a higher carbohydrate, lower protein diet because things like bread and pasta are mood foods for them. Now, if needed, there are also certain natural supplements like 5-HTP or medications that help balance this part of the brain. I talk about them in the book. But what I want to do is I want to tell you about a story of a man who came up to see me at one of my lectures, and he said, Dr. Amen, he said, I'm so grateful for all the things that you taught me. It's really changed the way I live my life, especially my marriage. He said, I'm married to a woman who has the cingulate from hell. No matter what I say, she says the opposite. It's so frustrating. For years, I just thought she didn't love me. And now I know it has to do with how her brain works. So if I used to ask her to go to the store, she would always get mad at me. It's like, I can't do that. Can't you see how busy I am? And so I stopped asking her to do anything with me. But now, after I've listened to you, what I realize is I have to ask things in the opposite. So if I want her to go to the store with me, I say, sweetheart, I'm going to go to the store. You probably don't want to go with me. What do you mean I don't want to go with you? Of course I want to go with you. We hardly spend any time. What is the matter with you? He said, you know, I'm just so grateful, but I'm still having one problem that I hope you can help me with. I said, what's that? He said, it's the sex thing. I said, what do you mean? He said, well, it doesn't sound right to say, I'm going to go have sex. You probably don't want to come with me. He said, do you have any ideas for me? And I have to tell you, I love that question because it tells us, it shows us how practical brain science can be. And so I said, okay, do this. Take her out for a pasta dinner, right? Simple carbohydrates boost serotonin levels to the brain. Next, take her for a long walk around the lake where they live. Exercise boosts serotonin levels to the brain. And then when you bring her home, give her a small piece of dark chocolate. Dark chocolate raises a chemical in our brain called phenylethylamines that increase the alerting response in the brain that something fun is about to happen. Then go in the bathroom and put just a little bit of baby powder behind your ears. Why? Baby powder is the most potent aphrodisiac on the planet for women. What do women think about unconsciously when they smell baby powder? Babies. Freshly diapered, cute little babies, and then they want one. And then when you come out of the bathroom, rub her shoulders and never ask for anything directly. About 3 weeks later in my email box, I got one email with 1,000 thank you phrases. Knowing about your brain helps you bring more love into your life. This is practical. Now, one more system that we're going to talk about deep in your brain is a very interesting part of the brain called the limbic system. It's your emotional brain, and it's critical to human survival because it is our emotions that drive us to love and to work. So our limbic brain's involved in our mood, how happy or sad we are. It sets our emotional tone, how positive or negative we are. It's involved with bonding, our ability to connect to other people. It's also involved in processing pain. Processes your sense of smell and your interest in sex or your libido. Isn't that interesting? That smells and sex go hand in hand. The whole perfume industry is based on that fact. Now, I already talked about baby powder as a powerful aphrodisiac for women, but did you know that cinnamon is a powerful aphrodisiac for men? And when I told my mother this, she hit her forehead and she said, "That's why I have 7 children. He would never leave me alone." Being Lebanese, she cooks with a lot of cinnamon. Now, when there are problems in this part of the brain, usually when it works too hard, people become sad and depressed, negative. They often feel hopeless or helpless. They are racked with guilt. They have what I call a high ANT population. Now, what is that? ANT stands for automatic negative thoughts. The thoughts that come into your mind automatically and ruin your day. And what a lot of people don't know is thoughts lie a lot. And one of the ways, if you really want to be well, is you have to learn how to just challenge or correct the negative thoughts that go through your head. You don't have to believe every thought you have. People who have problems in this part of the brain tend to isolate themselves. It's not good. Or correct the negative thoughts that go through your head. You don't have to believe every thought you have. People who have problems in this part of the brain tend to isolate themselves. It's not good. They're less interested in things that are usually fun, including sex. And they have a lot of pain. And it's so interesting that people with pain syndromes often have depression, and treating their depression often helps their pain. One of the great supplements that I often recommend, it's called SAMe, works not only for depression, but also for pain. Isn't that interesting? So how do you help this part of the brain? All right, I know I'm stuck on this, but exercise, and exercise is truly amazing. There was a head-to-head study recently comparing Zoloft, one of our great antidepressants, it's a really good antidepressant, with exercise. At the end of 12 weeks, they were equally effective. That's pretty cool. At the end of 10 months, exercise blew the socks off of Zoloft. Now think with me for a minute. At the end of 12 weeks of taking an antidepressant, okay, if it works, you're less depressed. But also 60 to 80% of people now have sexual side effects, right? I mean, these medicines have side effects. At the end of 12 weeks, you're less depressed. And you have a better body. So you're actually feeling a little more sexual. Exercise is critical, at least 4 times a week if you're depressed. And you're like, oh, I can't do that. But the more you do it, the more you can do it. Fish oil. It's amazing for this group. Why? Because fish oil has in it something called omega-3 fatty acids, found to be low in depression and low in people who try to kill themselves. Taking fish oil in a number of studies has been found to help balance out your mood. And people who live in the countries that eat the most fish have the lowest incidence of depression. Isn't that interesting? And you want to get rid of the automatic negative thoughts. You don't have to believe every thought that you have. And so in my office I actually collect anteaters, right? Just to remind myself, you know, if I'm feeling sad, if I'm feeling mad, if I'm feeling nervous, I write it out. And then I talk back to it. Right? You don't have to believe every thought you have. How many of you were good at talking back to your parents when you were teenagers? I was excellent. But you need to be good at talking back to those crazy, silly, distorted thoughts that are going through your head. And one that's just so simple. You get a thought in your head, you just ask yourself, is it true? Can I absolutely know that this is true? And so often, when you're feeling bad, your thoughts are lying to you a lot. Now, if needed, there are natural supplements or medications that can be helpful, which I talk about in the book. Now, in this segment, you can see my approach is really different. Knowing the part of your brain that needs help is the shortcut to getting well in the fastest, most efficient way possible. When I come back, I'm going to show you how to make your brain great. You are not stuck with the brain you have. You can make it better, and I'm going to show you how, including how to prevent Alzheimer's disease. And I'm not kidding. See you in a minute. Welcome back. So has anyone developed brain envy yet? Anybody want to have a better brain? In this last segment, I'm going to give you 5 prescriptions to make your brain great. We are going to talk about protecting your brain, feeding your brain, working your brain, exercising your brain, and preventing Alzheimer's disease. So let's start. Protecting your brain. Head injuries matter. They can ruin your whole life. So wear your seatbelt. Drive in safe vehicles. Wear helmets that fit. Golf is good. Tennis, terrific. Table tennis is the world's best sport, which we'll see. Head injuries matter. Protect your head. Avoid toxic substances. Alcohol, drugs, nicotine, too much caffeine, toxic fumes, and many medications, especially pain medicines and anti-anxiety medicines, are not very good for your brain. And make sure that you get enough sleep. Remember, less than 6 hours a night is associated with decreased blood flow to your brain. And anything that decreases blood flow to your brain prematurely ages your brain. You want to feed your brain right. I call this eat right to think right. You are what you eat. Literally. Your brain makes itself new every couple of months. A healthy diet is essential to healthy brain function. Now, the best brain diet is made up of lean protein, good carbohydrates. I call these complex carbohydrates that are also low glycemic. You probably heard the term low glycemic. That means carbohydrates that do not raise your blood sugar. So think green leafy vegetables or vegetables in general, and decrease bad fat, like trans fats. But not all fat. Did you know that 60% of the solid weight of your brain is fat? So that if somebody calls you a fathead, say thank you. So you need healthy fat in your diet, especially omega-3 fatty acids, because all of the 100 billion brain cells that you have, their cell lining is made up of long-chain fatty acids. And you get them through fish, such as salmon and tuna, avocados, and walnuts. And water is also critical to your brain. Remember, the brain is 80% water. Anything that dehydrates you is bad for it. And you want to make sure that you're drinking plenty of water throughout the day. So what are some brain-healthy foods? I put together a list for you of 12 of my favorite. And the first one's avocados. Why? Because of the omega-3 fatty acids. But this does not mean you can have a ton of guacamole. Because avocados also are fairly calorie-dense, right? And obesity doubles your risk for Alzheimer's disease. Obesity is bad for you. Okay, but a little bit of avocado is great for you, as are blueberries. In fact, I call these brain berries because they're loaded with antioxidants and they have fiber. Broccoli, because it has folate, very important vitamin for your brain. Green tea. Now, decaffeinated green tea is better, but green tea is amazing because in it, it has a substance called theanine. And theanine helps you relax and helps you concentrate at the same time. So it's sort of like the perfect supplement. And people that drink green tea on a regular basis have a lower incidence of Alzheimer's disease. Oatmeal, because it helps balance your blood sugar. Oranges for vitamin C. Red bell peppers. Did you know red bell peppers have 3 times the level of vitamin C as green bell peppers? Salmon for omega-3 fatty acids and great protein. Spinach for the B vitamins and helps balance your system. Tuna, turkey, and walnuts. Did you know that walnuts have 3 times the level of omega-3 fatty acids as almonds? But this does not mean double fudge chocolate chip cookies with walnuts. I tell my patients, eat from the rainbow. What that means is put foods in your diet that have many different colors, because that naturally increases the amount of antioxidants in your body to help keep your body and your brain young. But eating from the rainbow does not mean Skittles. I also recommend to my patients that they take 100% multiple vitamin every day. Why? We don't have balanced diets. We have fast food diets. According to the American Medical Association, people should take multiple vitamins every day to help prevent chronic illnesses like cancer, heart disease, and dementia. American Medical Association, people should take multiple vitamins every day to help prevent chronic illnesses like cancer, heart disease, and dementia. Almost 80% of us do not eat at least 5 servings of fruits and vegetables a day. You know, that's the recommended dose. Likewise, I believe all of us should take a fish oil supplement every day. Why? One of the main ingredients in fish oil, as I've said, is omega-3 fatty acids, found to be low in depression, low in dementia, low in people who have attention deficit disorder, and low in people who try to kill themselves. Taking fish oil on a regular basis every day has been found to be good for your heart, good for your skin, good for your eyes, good for your joints, good for your hair. Obviously, I started late. And good for your brain. I think all of us, as a baseline, should take between 1 to 2 grams a day of high-quality fish oil. Of course, you should talk to your doctor. And if you're a vegetarian and you don't want to take fish oil, you can take flaxseed oil. Now, the next thing to do is work your brain. Why? Because new learning is essential to keeping your brain young. Whenever you learn something new, your brain actually makes a physical new connection. When you stop learning, your brain actually starts to disconnect itself. Now, for this strategy to be effective, you need to learn things that are new and different for you. So, for example, if you're a gourmet chef and you learn a new recipe, well, that's not good for you. Why? Because you already know how to cook. That's like second nature or a piece of cake. But learning a language, or learning about a new country, or learning to play the piano can be just ever so helpful, and it doesn't take much time. 15 minutes a day. That's all it takes. Change your exercise, change your brain. Exercise is literally the fountain of youth. People who exercise on a regular basis have better cognitive abilities. They think better, their concentration's better, and their memory's better. Exercise boosts blood flow to the brain. Exercise also boosts growth factors in the brain that help you grow new neurons. What? I thought we were born with all the brain cells that we would ever have. Wrong! About 10 years ago, they discovered that the brain continues to make new neurons throughout life. How exciting is that? So you can actually encourage new brain cell growth just by exercising. Now, the best exercises for your brain are both aerobic, where you get your heart rate up, that's boosting blood flow to your brain, and coordination exercises, right? So just being on the treadmill, there's not much coordination with that. That's not necessarily good for your brain. But something like dancing, especially where you're learning new steps, now that is great for your brain. Unless, of course, you're drinking while you're dancing. The next great brain exercise, and I'm not kidding, is table tennis. Because you have to get your eyes, your hands, and your feet all to work together at the same time while you're thinking about the spins on the ball. There's this fascinating study from Japan where they actually scan people before and after playing table tennis for 10 minutes. And what they found is their cerebellum worked better and their prefrontal cortex, remember that? The most human, thoughtful part of your brain, also worked better. Table tennis is great for your brain. So more table tennis, less football, and boxing. Do you think boxing is a good brain sport? Say bad brain sport. Come on, let's be thoughtful about this. All right, who among you wants to live to 85 or beyond? Okay, you want to pay attention now. Why? Because 50% of people who live to 85 will be diagnosed with Alzheimer's disease. Wow. Well, that means you need to pay attention, and you are at risk for Alzheimer's disease. If you have a family member that has it, if you have a personal history of a head injury, heart disease, a stroke, diabetes, cancer, ADD, or depression, you're at risk for Alzheimer's disease if you don't exercise twice a week. You're at risk for Alzheimer's disease if you do not engage in regular lifelong learning. And if you pay attention to me, I'm going to teach you how to prevent it. With these strategies that I'm going to talk about, you can delay the onset of Alzheimer's disease by 6 years or more. But you need to make these interventions part of your life now. So what I'm going to do now is I'm going to talk to you about each of the risk factors for Alzheimer's disease. Okay, so the first risk factor is genetics. You have it in your family, and there's certain genes that increase your risk for Alzheimer's disease. So if you have a genetic risk, how do you decrease that risk? Well, you can't get different parents. So what that means is you have to take prevention seriously, as early as possible. The next risk is a brain injury. If you've had a brain injury, you have a higher risk, especially if you have Alzheimer's disease in your family. Now, how do you prevent getting a brain injury? Wear your seatbelt. Drive a safe vehicle. Wear helmets that fit. Don't play with your brain. And if you had a head injury, know that you're at a higher risk and you have to take prevention seriously. If you drink too much alcohol, you now have a higher risk for Alzheimer's disease. How do you decrease or eliminate this risk? Stop drinking. This is not that hard. Drink less. If you have cardiovascular disease, including hypertension or high cholesterol levels, that increases your risk for Alzheimer's disease. How do you decrease that risk? It's diet and exercise. And if you have heart disease or vascular disease, don't play with it. Get it treated. Because when these things run away from you, you are so much more likely to be demented. If you exercise less than twice a week, you now have a higher risk for Alzheimer's disease. So how do you decrease that risk? Exercise more. If you drop out of school, or if you're in jobs that do not require lifelong learning, you have a higher risk. So how do you decrease that risk? Regular, lifelong learning. Always be enrolled in some sort of educational activity. If you have diabetes, that increases your risk. So how do you decrease the risk of diabetes? Diet and exercise. And if you have diabetes, you want to make sure it's tightly controlled. Otherwise, it's a blood vessel disease, and it causes disease in your brain. Smoking. Smoking's a nightmare for brain function. Now, interestingly, the early studies on smoking and Alzheimer's disease said smoking protected you from Alzheimer's disease. But when they actually looked at the data and they figured out how it protected you from Alzheimer's disease, do you know how it protects you from Alzheimer's disease? You're dead! Dead people don't get Alzheimer's disease. But when they corrected for the dead people, what they found is it increases your risk. Of course, because it's constricting blood flow to the brain and it's poisoning you. Untreated depression and untreated attention deficit disorder are risk factors for Alzheimer's disease. So how do you prevent that? Because you treat them. These are brain disorders. Cancer treatment. How unfair is that? You get cancer and you have to take chemotherapy, but as chemotherapy kills cancer cells, it also kills normal cells. So if you've had chemotherapy, you want to be on a brain healthy program as early as possible. Make sure you talk to your doctor. People who have sleep apnea, you know what that is? People who snore loudly, stop breathing multiple times at night, chronically tired during the day. Untreated sleep apnea doubles your risk for Alzheimer's disease. You should get it treated. If you get your nails done or you get your hair done too often, it increases your risk. You know, one of the occupations at the highest risk for Alzheimer's disease are cosmetologists, and I think it's because they're being poisoned. When you go get your nails done or you go get your hair done, make sure the place you go has great ventilation. The treatments we have for Alzheimer's disease work early, really early. They don't work late.